A young boy brings his mother into the ER with major injuries, broken ribs, jaw, and lacerations to her arm. After thorough assessment, the ER nurse comes to the conclusion that the injuries didn't happen from falling down the stairs like the patient had said. When the nurse notices the patient was in the ER 6 months prior with similar injuries, the nurse is told by the son that the patient was hit several times by his father. The patient denies this accusation, but the son pleads for help from the nurse. What is the rule as the LPN?
Justice. The mother in this situation deserves to be treated with respect and know all of her rights. She deserves to know the different treatment options, as well as that it is her choice whether or not she would like to seek outside help, for example, counseling or police services. Because the son is involved in this scenario, his rights need to be assessed because it is possible he may be in immediate danger with his living situation. It is important for the nurse to assess and discuss these issues with the patient, but the nurse must know that it is the patient's choice in the end and cannot force her to take more action. Both the mother and the son have the right to health care as they are both from Canada. Confidentiality. The nurse should also ensure the patient knows that their conversation is all confidential, but if she feels that her child may be in danger, it is the law to report. Nurses are required to report any event that they feel a child is at risk of harm or neglect under the Child, Family, and Community Services Act. It's important to consult with supervisors or more knowledgeable and experienced colleagues when unsure on what steps the nurse should take in these situations. The nurse should be familiar with all hospital policies and know how and where to make any reports. The nurse should always be careful when providing information to clients they suspect are being abused. Ensure all conversations are done in private to ensure patient safety.
Laws. Assault. Intentionally applying force to another without that person's consent or threatening to do so. Injury is not required. It is the professional's position to educate the patient on his or her rights, and the decision of reporting domestic violence to police is up to the person if there are no children involved. Under the law, police and legal services promote safety of all its citizens. Victims may also be able to obtain a restraining order for protection under the provincial family violence legislation.
Professional standards. Standard 3. Client-focused provision of care. Indicator 3. Supports clients to learn about the healthcare system and to access appropriate healthcare services. By providing the patient with different healthcare options, she can see that she is not alone and that there are options out there to support and help her through this time. Standard 4. Ethical practice. Indicator 5. Recognizes, respects, and promotes the client's rights to be informed and make informed choices. As an LPN, I understand that the patient has the right to make her own choices, and it is not up to me to break confidentiality and report. I can help her to know that she has options, but I know I cannot make the choices for her or push her to do something that she isn't ready to do.
Beneficence, non-maleficence. The physical injuries that the patient received are broken ribs, broken jaw, and lacerations to the arm. To diagnose broken ribs, you can use X-ray, MRI, CT scan, or a bone scan. Prognosis of fractured rib usually takes at least 6 weeks to heal. During recovery, it is important to rest, apply ice, manage pain with analgesics, and cough or continue with deep breathing exercises 3 times in an hour. To diagnose a broken jaw, you can use X-ray. The prognosis of a jaw fracture or break may require surgery depending on the extent of the injury, are bandaged or wired shut during recovery. Healing takes at least 6 weeks. Painkillers and antibiotics are prescribed to prevent infection and manage pain. To diagnose deep tissue lacerations is just observational. The prognosis of a laceration will be closed with sutures and take 3 to 4 weeks to heal. Sutures can be removed in 10 to 12 days. Lacerations will require daily cleaning to promote healing and prevent developing an infection. The goals of therapy would be: patient is accepting and compliant with her course of medical treatment, care plan, and the medical advice she receives. Patient recovers from physical injuries and regains full physical functionality. Patient receives financial, psychosocial, and psychological support from community supports, social work, counseling, etc., to help escape domestic abuse for the safety of child and self. Patient protects herself and child from domestic violence by walking away and refusing to put herself in the situation for the abuse to happen again in the future. Efficacy in this scenario would be patient recovers from physical injuries in an appropriate time frame, patient admits to the ongoing abuse and escapes from the toxic relationship, patient receives support from financial aid, social work, community supports, women's shelter, and etc. in order to provide for her and her child. Patient receives a variety of therapies such as psychoeducation, counseling, etc. in order to create a safety plan, educate patient of what a healthy relationship looks like, treatment of PTSD, and building patient's psychological health, etc. Inefficacy in this scenario would be patient does not admit to the ongoing abuse, patient receives medical treatment but returns to the abusive relationship and puts herself and child at potential harm. Patient returns to ER 4 months later with extensive injuries.
Autonomy. After fully informing the patient of her rights, confidentiality, safety, and education on how to report violence to the police, and if the patient consents, the LPN can report the incident to the police for her. Nurses will only disclose information with consent or when there is specific ethical or legal obligation to do so. Legislation that requires you to disclose information in domestic violence situations include the Adult Guardianship Act for vulnerable adults and Child, Family, and Community Services Act, children under the age of 19. If taking photos, make sure it is compliant with policy and obtain her consent. As she has the full capacity to make decisions for herself, there is no need to identify her advance directives. If she refuses to consent to any of these points, the nurse's duty is to respect her decisions.
Utility. A person's act is only morally right if it produces the best possible results in that specific situation. It focuses on the well-being of an individual. Bias in healthcare can be dangerous as it can impair the LPN's clinical decision-making. Many domestic violence survivors hesitate to get help because they are worried their confidentiality will be violated or they will be judged. They fear Child Protective Services might be called, their abuser may be arrested, resulting in loss of housing, employment, or welfare benefits. Some biases about women abuse victims include they're viewed as weak. If they can't stand up for themselves, then why should someone else stand up for them? They're being selfish by choosing to stay in the relationship. They deserved it, and that they are seeking attention. The LPN should explore his or her own personal beliefs about domestic violence. Being non-judgmental allows the patient to speak freely without feeling judgment. This encourages the client to share more information or details and helps the LPN to better evaluate the situation. The LPN can then determine what steps to take to improve the mother and child's quality of life.
Cultural considerations. We must consider cultural differences as Canada is very diverse. Some considerations we should take into account when caring for a woman who has been abused is the belief that men have a right to control women, and if the woman reports the abuse, it is considered to be disrespectful. This may make women more vulnerable to physical and other forms of violence, or make a woman experiencing violence less likely to report the abuse or otherwise seek help. Some barriers are fear of stereotypical attitudes and stigmatization towards Aboriginal women, impact of residential schools including mistrust of institutions, including healthcare and criminal justice systems, and or a history of abuse, victim's fear of apprehension of her children by social service agencies, family or community denial that abuse is occurring or a fear of isolation by community if abuse is reported, and lack of services or support in remote or rural communities.
In this video, Leslie Steiner speaks about her relationship and experience with domestic violence. She addresses misconceptions many people hold against women dealing with domestic violence and how to break the silence. This article outlines how the media negatively affects the way female domestic violence victims are portrayed. It talks about how individuals are influenced to hold women responsible and excuse men for their actions. It also discusses how abuse is downsized and normalized.
Abused women in the media. Rihanna was a victim of domestic abuse from Chris Brown in 2009. Shakira suffered domestic abuse from an old boyfriend. The Colombian singer has become a symbol of women's empowerment across the globe. Robin Givens was a victim of domestic violence at the hands of her husband, heavyweight champion Mike Tyson. They divorced in 1989. Nicole Brown Simpson was the victim of abuse at the hands of her husband O.J. Simpson. Nicole Brown Simpson was murdered in 1994, and although he was acquitted, many people still believe that O.J. Simpson was her murderer. Madonna was raped on a New York rooftop when she was just 19. She also suffered mental and physical abuse from her ex-husband Sean Penn throughout their 4-year marriage.
The severity of the psychological repercussions of violence against women can vary depending on many factors, although not every case results in significant emotional or psychological problems. The victim may experience difficulty maintaining healthy relationships and being productive at work. They can be at risk for developing mental health issues like depression and are more likely to encounter the following psychological issues, including anger, anxiety, dissociation, mood disorders, PTSD, shame, self-destructive behavior, and trust issues. The role of a counselor in abuse against women is to provide talk therapy in a confidential and non-judgmental environment. They focus on facilitating positive changes by discussing feelings, experiences, and behaviors with the end goal of helping the client to make an individual decision about what to do in a violent relationships and what steps they can take next. Counselors are also equipped with resources to provide women experiencing violence, such as information about local women's shelters and help hotlines. LPNs and counselors do not typically work directly together, although the LPN may refer a woman experiencing abuse to a counselor. They can explain the services a counselor is able to provide and how it may be beneficial.
Physician. A physician's main role is to do a thorough assessment of the patient to ensure her injuries are properly taken care of and any pain she might be having can be properly managed in order to take the right steps toward her recovery. The physician works to take a detailed patient history during assessment, and after he will document his findings and give the nurses and all other staff an overview of the situation. If questions about domestic abuse are normalized and asked routinely, then it takes away the discomfort for both patient and physician. The physician can then work alongside the other staff members and with the patient to come up with a plan. The physician can refer the patient to social work and possible counseling, and if necessary, a psychiatrist or domestic abuse counselor. If the patient is not ready to take these steps yet, they should be sure to provide her with the phone numbers or emails of the resources and also be sure to book periodic follow-up appointments with her. The LPN and the physician work together to talk about the patient's plan of care and how they will go about her care. It is important all healthcare workers are on the same page so that they will communicate the same message to the patient. The LPN can provide support and empathy for the patient as well as providing her with other resources.
Social worker. Social workers will start by conducting an interview or a written assessment. This will determine the level of violence the victim is experiencing and if they are in immediate danger. They may also focus on the children and encourage the mother to see the world in the way the child is seeing it right now. They provide counsel to encourage the safety of the victim and strategize ways for them to escape the domestic violence they are experiencing. They suggest places the mother and child could stay short-term and may also provide information on how to attain a restraining order. A referral may be made to a support group or psychotherapy. Once the client is safe and stable, the social worker will continue checking up with the client's progress periodically and maintain contact with all of her collateral service providers, such as primary care physicians or psychiatrists. The LPN can work alongside the social worker and advocate for the woman and her child by referring them to a support group or a women's shelter that is safe. The patient could also come in for routine assessments with the nurse, which the social worker could then contact to gain more information on the situation. The social worker and LPN can demonstrate informal leadership by being an advocate and a support for education to the patient by informing her of her rights and the decision of reporting domestic violence to the police.
The registered nurse can further assess the patient's physical injuries, health history, psychological health, living conditions, support system, and etc. The RN should ask specific questions about violence to imply knowledge of the problem and willingness to help. The registered nurse should reassure the patient that she is not alone, believe that the violence is unacceptable, assure confidentiality through the information must be documented, document findings, educate the client on her options, such as personal protection order, the resources available, and the likelihood that the violence will be repetitive, and develop a safety plan that may be utilized by the client for a way to leave the spouse. If the patient isn't ready to admit the domestic abuse or ready to take steps for change, the RN should still provide brochures, contact information of a social worker, community supports such as domestic abuse counseling services, legal aid, and etc. The RN can work with the LPN to assess the patient's guide in what direction to take, provide education support, as well as resources and supports the patient can utilize. The RN and the healthcare team can educate the patient by informing her of her rights and the decision of reporting domestic violence to law enforcement. Depending on hospital policy, the RN will refer the patient to a social worker and child protective services due to the child's story and extent of mother's injuries. In order for plans can be made to ensure the health and safety of the patient and her child.
The conclusion we came to when solving our ethical dilemma was that, as a nurse, we cannot report this incident as it would be breaking client confidentiality. We can, however, report it if we suspect that the child is in any danger. In this case, the mother listens and learns from the medical team and takes the opportunity to seek outside help from police, as it will better her and her son's life.